Hello, everybody, and welcome back to our series of videos on our Level 3 Anatomy and Physiology. So, today we're carrying on from our cardiovascular studies, and we're going to be looking at blood pressure now. So, what actually is blood pressure? It's something we talk about a lot, and it's something that we measure as part of our health and sort of our fitness screening at the start of our consultation, but we need to understand what it really is and what the implications are for exercise. So let's have a little look. So, blood pressure is the measure of force against the artery walls. So, that's produced by the contraction. That's that systolic part of the heartbeat, and the systolic part is where the ventricles contract, and that's where you have the pressure in the arteries. So diastolic is where the pressure in the arteries, you get the relaxation during the relaxation phase. And by regularly exercising, you can actually have quite a significant impact on blood pressure by reducing it or even normalizing it. So we want to make sure when we're talking about blood pressure that we're getting the most up-to-date guidelines and the latest research. So these are just some examples of where you can go to look to check that the blood pressure guidelines you're using are the best ones. So the British Heart Foundation, World Health Organization, the NICE, you may have heard of, the National Institute for Health and Clinical Excellence, and the ACSM, perhaps the most relevant to us, the American College of Sports Medicine. Worth going on all those websites and just seeing what their latest advice is. So whenever you think about looking for sources of information, make sure they are reputable and they are scientifically based and up to date. So these are the blood pressure classifications that we're working from, and they're all measured in millimeters of Hg as mercury. The old-fashioned sphygomanometers used to have that tube with mercury in it, but you're much more likely now to see an electronic blood pressure cuff, which is like down at the bottom, like the image at the bottom of the screen. That's probably the one that you will use, much easier. So these are the different classifications. So we've got hypotension, which is low blood pressure, is anything below 90 systolic or below 60 diastolic. Normal ranges from 90 to 120 systolic to 60 to 80 diastolic. Then there's pre-high blood pressure, 120 to 140 systolic, 80 to 90 diastolic, which is by no means contraindication, but just suggests that maybe there needs to be some lifestyle changes for that individual. Then you've got stage 1 hypertension, where it's either greater than 140 systolic or greater than 90 diastolic. Stage 2, greater than 160 systolic or greater than 100 diastolic. And severe hypertension is over 180 systolic and 100 and over 100 diastolic. You do not treat people, you do not work with people in severe hypertension, but we'll come to that now. So those are the classifications, and I'll show it to you in a table that you might find easier to work with. Sorry, it's a little bit blurry, but I think you can probably see the different categories. And it's always worth checking. It's like norm referencing, as with anything else. You want to check against a chart to see where your client falls, just to check it's okay to continue. So let's think about the implications for exercise within all those different categories. So if it's hypotension, low blood pressure, ideally the client should speak to their doctor before starting any new exercise, but it's not a contraindication. Between that hypotension and pre-hypertension, it's safe to be more active, and actually it's a really good thing because it's going to help keep blood pressure in that ideal range. And then in stage 1 hypertension, it should be safe to start increasing physical activity. Over 180, you've got to speak to the doctor, and above that, you wouldn't be managing a client. You'd need to refer them back to the doctor for that. So those give you some ideas of the implications for exercise for the different blood pressure ranges. So let's think about the actual response to exercise. What's happening? So in the short term, during exercise, the systolic, that's the contraction phase of the blood pressure, will increase proportionally with exercise intensity. So obviously, the harder you work, the higher your systolic blood pressure is going to be. And it's heavy resistance training that's going to increase that systolic pressure the most. And we have to take that into account when thinking about any clients with cardiovascular disease. Diastolic tends to remain largely unchanged short term. Then longer term, where we're thinking weeks and months, those with kind of the pre-hypertension or mild hypertension, both their resting and exercising blood pressure can actually reduce by up to 10 millimeters of mercury with kind of more endurance type CV exercise, which is obviously very positive health benefit. And also the time for the diastole, that rest phase within the heartbeat, increases. And if that rest phase increases, that gives more filling time for the coronary arteries. So that improves the coronary blood flow. Good thing. We have to be aware of the risks that there are to people with blood pressure issues. So I mentioned before about heavy weight training and also isometric exercise. Both of these things can significantly increase both the systolic and the diastolic blood pressure, and this can cause real fluctuations. So you might have heard of something called the Valsalva effect, and that, if I read it out to make sure I get it right, so it's that maneuver of holding your breath during exertion, and so often it is associated with that heavy weightlifting. So it's that kind of forceful exhalation against a closed mouth and nose, as if you're blowing up a balloon. So this can be really dangerous for those with cardiovascular disease and should also be avoided during pregnancy. So postural hypotension, so that's when you feel dizzy when you suddenly get up because your blood pressure is dropping. And that can occur when going from, having quick changes of position from lying to standing, or actually after you've been standing for a long time. So you just have to be really aware that in older adults and in pregnant women, this can be a particular issue. So it's really important to think of when you're creating your exercise programs, or maybe you're watching this and you're doing sports massage therapy, you need to think about the advice you give to your clients about the speed with which they change position, and just sort of be mindful of any issues around this that they might have. So recommendations, with just recapping here. So those in hypotension and stage 1 and 2 hypertension should seek medical advice prior to exercising. And it's important to make sure that people fill in their PAR-Q correctly and that you actually go and read it so we know what we're dealing with. And in very severe hypertension, that's contraindicated to personal training. Now, if you go on and do your exercise referral course, then that might allow you to manage these kinds of patients, but often they'll be managed properly under medical conditions only. So just be aware of when you can and when you can't work with a client. So now we're going to look at some particular terms associated with circulation. And the three words I want to look at here are cardiac cycle, stroke volume, and cardiac output. So the cardiac cycle should seem familiar. It's that sequence of events that occur when the heart beats, and they're the two phases. You've got your diastole and your systole, or diastole and systole. They're discussions as to which is a correct pronunciation. Diastole and systole. So that's the contraction and relaxation of the myocardium. And if you remember, myocardium is the word for heart muscle. Stroke volume is the amount of blood pumped from the heart in a single beat. And then cardiac output is the amount of blood pumped from the heart over a minute. So that's the difference. Stroke volume, single beat, cardiac output, a minute. And let's just look a little bit more at that cardiac output. So again, just look at that image. It's in 1 minute. Cardiac output, 1 minute. And if you think about it, during exercise, cardiac output, the amount of blood pumped out the ventricles, is going to have to increase because the demand for oxygen in the body is going to increase. And therefore, more blood needs to be pumped around the body to supply the muscles with the oxygen and nutrients it needs. So you work out cardiac output by looking at the stroke volume and timesing it by the heart rate. So we know, once you know the stroke volume is how much blood is pumped out in 1 minute, in one beat, and then times it by the number of heartbeats in a minute, you get your cardiac output. So an example here, if the average stroke volume is 71 mils and the average resting heart rate is 70 beats per minute, we get an output of nearly 5 litres per minute. So that's cardiac output. So we're just going to have a little review of the short-term effects of exercise on the cardiorespiratory system. So this is just during exercise. You're going to be breathing more because we're trying to get more oxygen in the system and get rid of more carbon dioxide. There's going to be an increased tidal volume. Now, I always literally picture the tide when I think about the word tidal volume, and it's the amount of air moved in and out of the lungs in one breath. It's like how far the sea moves in and out in one sort of wave motion. So tidal volume. The actual gaseous exchange is going to become more efficient. That taking in of oxygen, loading of the hemoglobin, and then the releasing of the carbon dioxide. You're going to get an increase in your heart rate, in your stroke volume, remember the amount of blood pumped in one beat, in the cardiac output, amount of blood in 1 minute. You're going to get dilation of the blood vessels that go to the muscles because we're trying to supply them with the oxygen they need, but you're going to get a constriction of the blood vessels to the internal organs. So blood's being redirected to where it's needed. And you're going to get an increase in the coronary blood flow as the heart is working harder. So it's all interlinked. The long-term effects of exercise, looking particularly at the cardiovascular response. So we're thinking here over weeks and months. Your resting heart rate is going to go down. And then we'll think about the implications of that. Because your heart's been exercised more, you're going to have a stronger heart, and the actual myocardium, especially on the left-hand side, the muscle is going to be bigger, so it can have a stronger contraction, so it doesn't have to beat as many times. You've got improved the coronary blood supply that we looked at in the previous session improves because with the reduction in heart rate, you've got more time for the diastole, the resting phase, where those coronary arteries refill. So it's very good for the heart muscle itself. Post-exercise recovery time improves, so you get much better recovery. You actually have more blood in total. You've got more red blood cells. Overall, your circulation's more efficient, and you've got a decreased risk of coronary heart disease and other diseases such as type 2 diabetes. So lots of benefits on the cardiovascular system. And here are some of the longer term benefits associated on the respiratory system. Your breathing rate's going to drop down. That tidal volume is going to increase, so there's a greater amount of air capacity as you breathe in and out in one breath. Increased vital capacity, and now that's kind of the maximum you can breathe in and breathe out in one breath. That improves. Your respiratory muscles, remember those, your intercostals and your external obliques, all the muscles involved in respiration become stronger, better endurance. You get better capillaries, actually increase capillarization. So new capillaries form within the lungs and muscles. We've said that twice. Increased endurance of respiratory muscles and increased efficiency of carbon dioxide removal and oxygen uptake. So all in all, the whole system just becomes much more efficient. And that's it. So that's everything you need to know on blood pressure, its links to exercise, and that terminology associated with the heart. Okay, I hope that was helpful. Thanks very much.